Good evening, everyone. My name is Bianca, and welcome to the New Teeth Now webinar. I am here tonight with Dr. Kirkpatrick, and tonight we're going to be talking all about dental implants and all that New Teeth Now has to offer. So we'll get started. How was your Thanksgiving?
It was actually a really needed break.
Yeah.
For sure. It was good. We hung out with the family and ate too much food like everybody else, I'm sure. And had a good time.
Good.
It's good to get back to work too.
Yeah.
Yeah. So thank you guys for joining us. As Bianca did a really good little introduction there, probably better than I deserve, but we are going to talk a lot about implants tonight. And, speaking of eating, Thanksgiving food, there's some people, if you have bad teeth or dentures or partials, then that can be difficult. And, I saw a couple of patients today for consults that, kind of had that same story, that they were here because they partial on the bottom and a denture on top and just had a really difficult time, couldn't bite into anything. And one of the comments was, I can't even bite into turkey.
Oh,
so
yeah.
she was looking for, some options, and she came here for a consult, and hopefully she does a treatment with us and it'd be life-changing. So, excuse me. We are going to talk all about implants, and my name is David Kirkpatrick. I'm a board-certified oral and maxillofacial surgeon. And just so you know a little bit about my background, I won't go into too much in detail with that, but I'm originally born and raised in Kentucky, went to school at the University of Kentucky, and did my surgery training at University of Florida in Jacksonville. And, once again, that board certification, that's really important. Whether you come here to see me for, treatment, or you seek treatment elsewhere, just make sure that whoever is treating you is board certified. It's really the only way that we have to kind of regulate ourselves and make sure that everybody's up to a certain level of care. And it's one of those things that if people are not board certified, they tend to just never mention it.
Right.
They go through the consult and all about all these great things that they did, but they kind of leave out that or not say that they're board certified. It's very important. So dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know what an implant is, because I get a question or two about this at least every week. So here is an implant. It's the gray silver screw looking structure there that I'm trying to outline with the arrow. And the implant goes into the bone. The implant is not a tooth. So the implant replaces the root of the tooth, and it gives us or your dentist a platform to build the tooth on. And, with the New Teeth Now procedure, which is what we're going to spend the majority of the night talking about, it's a picture like this, which is a really cool picture. It shows 4 implants, and with 4 implants on the lower jaw, we're able to secure the entire lower teeth on. So it's one big bridge, all connected and screwed into the implants. So it's a very good way to replace missing teeth in one jaw. And on the upper, which is another really good picture, and I love the new picture you picked out. So this is an updated picture, and it shows, 6 implants, which is what I do on the upper jaw. So my typical patient receives 6 implants on the top and 4 to 6 implants on the lower jaw. And you can see how these implants are situated kind of in their little ghost mode up here, and showing, 2 on one side, 2 in the middle, and 2 on the other. And with this one big horseshoe bridge going across. And that ensures that you've got a lot of stability when you bite into food, and also when you're chewing on the back teeth, which is important. You need all-around stability to secure the bridge. So when you're chewing, especially the way that we designed this with the New Teeth Now, when you chew on the right side, the force is evenly distributed across the arch, which is one of the reasons that you're able, as one of our patients, to get teeth on the same day. And we'll talk about that a little bit later. But what I'm going to show you is a lot of before and after pictures of patients that I've personally treated, And we'll let you see some videos where patients talk about their experience. And because I think that's, from a patient standpoint, that's what I would want to hear and know. Other than, some doctor trying to tell me all about what he can do with implants. If you can hear it from patients I've treated, I think it's a little bit more powerful.
Definitely.
So with this patient, there's his before and after. And that's just a dramatic difference. He had a lot going on in the before picture. He's got periodontal disease. He's got bone loss. He's got gum recession. He's got cavities. He's got missing teeth. He's got broken teeth. Pretty much anything you can have. And if you look really close on that picture, that little thing that the arrow's pointing at, that's an infection that's associated with a tooth that's eaten its way through the bone, through the gum, and it's just draining into his mouth. Just a really bad thing to have. But he came in and he'd been told he needed all of his teeth out and needed to have a denture made. And he didn't want anything removable, so he wanted to know if he was a candidate for implants. And he was. So we took all the teeth out, got rid of all the infection, put in implants, put in new teeth, same day, and that's his post-op.
And such a big difference.
It's a huge difference. And, he's got a great personality. He had a great personality before we did anything to him, but now he walks around, he's wanting to smile for everybody and just show everybody his new teeth. Another one of my patients, and this lady, everybody's got a different story, and we get to know our patients on a personal level because, we're around you quite a bit for, during the recovery. And, with her, she had a car wreck when she was in her teenage years, broke off all the upper front teeth and all the way across. And she had this partial denture that snapped over the remaining teeth and just, basically masked and covered all those broken teeth. So she came in, she was really tired of having that. And we took all the roots out, all the remaining teeth out, put in implants, and that's her after. And that's a fixed bridge that just, it looks like a different person.
Yeah.
So it's kind of cool to walk through patients with their going through the procedure and going through the recovery and seeing the effect that it has on them. So this is Terry, and he actually works for us. He's one of our New Teeth Now lab technicians, and he also had a great story where, he's working so much on making everybody else have a pretty smile, he kind of neglected himself. Mm-hmm. And, it's cool to hear his story and to see kind of the process that he went through to get his teeth. So we're going to play a little video about Terry and just kind of let you guys get a feel of what he went through here.
I've had a go-kart accident where I flipped over, actually smacked my face, and knocked all my teeth so they were just dangling out of my mouth. My name's Terry McCook. I have been a dental technician for New Teeth Now for the last 4 years, making people's teeth here every single day. When I have people's models in front of me, I'm like, this guy's teeth are nicer than mine. I was a truck driver for a few years. Got my head stuck between a loading dock and a truck and a dresser. That sliced me here, but erupted these teeth. My teeth used to be fairly straight across the bottom, but it all erupted. Most of the people I hang out with, I bike ride, I kayak, I paddleboard. I'm 20-something years older than most of these people. I keep up with them. I don't have the smile to say, hey, look, I'm young. When I smile, it shows more of my age. And I'm looking to take the journey to be a New Teeth Now patient.
All right, Jerry, we're going to do 2 pictures first.
Okay. Jerry, how you feeling?
I feel good. I know I'm well taken care of. I feel very comfortable. It's like family's putting me to sleep.
Do you trust this family?
Yes, I trust this family more than I trust my family. Everyone in here is very professional. Surgeons are absolutely the best I've ever seen anywhere. I see the results from people every single day. And I'm very excited to get some new teeth now.
All right, man.
I don't want to look.
Huh?
I don't want to look.
No, yeah, you do too. You gotta see what they did upstairs.
Wow.
Hey.
Oh my God. Wow, I love it. Oh my God. Whoever did them was an artist.
You know, it's funny sitting here with you watching this because we're watching the video as you guys at home are watching the video, but we have no sound. So it's kind of funny to put in our own little words of what we think Terry's saying or what we'd rather him say. But anyway, we'll see another video of Terry, and it's about
how his life is now, how he's changed from like the inside out and everything that way.
So that'll be a little bit later. So make sure you stick around to see Terry's reveal. So why do people do this New Teeth Now procedure? Definitely the number one goal should be to restore total body health. There is a huge relationship between the health of your mouth and the rest of your body. There's a lot of research that has been done on it years and years ago. There's research still being done on it. And, you know, we'll talk about periodontal disease in a second, but there's a big relationship between your mouth and your heart and your lungs and your stomach and a lot of the other parts of the body. So you really need to pay attention to that. Definitely the New Teeth Now procedure can help improve your self-confidence and bring out a smile. The ability to eat kind of takes you back to when you had nice, healthy teeth, so you can bite into food properly and chew your food properly. You are asleep during the entire procedure. So for those of you who have a true dental phobia or just scared to come to the dentist, this is something that you should consider because, you know, you're asleep during the entire procedure. You wake up, it's over with, and you go home with new teeth in your mouth. And then the postoperative pain level should surprise you. It does us to hear from our patients, you know, consistently where, you know, we've done this procedure, we take out all the teeth, remove any infection that you have, put the implants in, new teeth on, and the patients come back and they'll say, yeah, you know, I had a little discomfort, but it was nothing what they expected. And, you know, they may have taken one or two pain pills.
Yeah, a lot of them don't have like memorable pain. Like
Right.
They can't remember.
Yeah, exactly.
Even. Yeah.
And they'll say that, oh, well, you know, I did take one of the pain pills because I was scared I was going to have some pain, but they never got that. And if they did, it was something that was managed with just ibuprofen and Tylenol. So it's, you know, it's not that bad of a procedure, especially considering the amount of work we're doing. So the oral body connection, you know, your mouth is a gateway to a pretty awesome creation. It's the first thing that encounters the foods you eat and the air you breathe. And with periodontal disease, we know that there's a big relationship between increasing your risk for heart attack, stroke, for women, low preterm birth weight babies, diabetes, osteoporosis, respiratory diseases, digestive diseases. But really what it all comes down to is, you know, periodontal disease is just a low-grade chronic infection that you may or may not know you have. It may or may not be painful. And, you know, it's something that it's just your body fighting an infection, which the longer your body fights an infection, reduces the effectiveness of your immune system,
Right.
which ultimately can shorten your life expectancy. So it's a really serious thing.
It is.
So here's a picture of what periodontal disease can look like. And, you know, this, you know, we try not to put a lot of gross pictures in the presentation. And this is a very kind of minor presentation with periodontal disease, but it gives you a good idea. So that arrow is showing where the junction, oh, it kind of disappeared on me, of where the crown and the root meet. So all this darker yellow, brownish area, that's the root of the teeth that you see. So that's where bone loss has occurred. Gum follows, and you start to see a lot of the root. That root can be very sensitive to sweets, to hot foods, to really cold foods. So it can cause a lot of problems. And it's an infection. You know, and this is what we did. You know, so this is the same day. I took out all the teeth on the top and bottom, and this is showing implants in. And those little silver structures that you see coming through, those are impression posts. So I put those on the implants, take an impression with your temporary teeth that we've had pre-made, send it up to the lab, and then when they'll make them fit your implants. We unscrew those little posts, which it would look like that, put on the teeth, and you look like that. And that is after. So huge difference between before and after. And he's got nice, healthy gum tissue.
Removes all the periodontal disease.
With no more infection, no more periodontal disease. And the really cool thing about it is that it's gone and cured from day one.
Right.
So the day that we do this, all your infection's gone. So if you want to be truly healthy, you must restore your oral health. So who's a candidate for this procedure? Of course, patients who have no teeth or unhappy with dentures, people who have a mouthful of bad teeth, people who have severe periodontal disease, and especially if you've ever been told that you don't have enough bone for implants, you need to come see me. I've been here for 12 years doing this, and I've yet to have a patient that couldn't do this procedure because they didn't have enough bone. I mean,
that's amazing.
And we do this literally every day. So that, I think, speaks volumes. But we do see patients all the time that will tell us, like, all right, I'm here, my husband or my wife or a friend talked me into coming. I've seen other, had other opinions from a couple other people, and, they told me I didn't have enough bone for implants. And, I'm looking at the CT scan and saying, like, oh yeah, you've got gray bone. 100% we can do this. So you need to, if that's your excuse, you need to come see me. The New Teeth Now, we've got different techniques and able to do different procedures that really let us treat pretty much everybody. So, and we have people from literally all over the world come in to see us. We have, celebrities, like, you'll probably recognize this guy, but, I had a patient call in that I talked to over the phone and did basically a phone consult from the Netherlands. I had a patient from Iceland call in, and just, so literally all over the place. But, this patient, he's special to us for a lot of different reasons, but he's got a really cool story. And, when you hear it, you just, like, you want to help him, and to watch him go through the procedure and see how it really affected him. You'll enjoy this video.
All my life, for as long as I can remember, my teeth were crooked. My teeth were so ugly, I avoided most social interactions. I didn't want people to see me up close. After New Teeth Now, I love my smile, as opposed to before when I was just like, I can't do this, nope. So on surgery day, I kind of walked in there with this fear of, oh my God, this is gonna hurt. I don't know if I'm ready for this kind of pain. They put me under around 8. That was all she wrote. It felt like I just fell asleep and they were just starting to wake me back up. That anticipation of pain that I was expecting never showed up. So that was pretty cool. Dr. Kirkpatrick, not only is he someone who's really good at what he does, he doesn't try and decide for you. He gives you all the facts and lets you decide. During the consultation, he was able to explain to me the step-by-step process that it would take, and the idea, the fact that the day of the surgery I would leave that office with a new set of teeth in my mouth. So you mean on April 3rd I'm walking in here with these bad boys and some new ones getting put in, and I'm walking out with the new ones? Let's do it. He's an amazing human being, and someone that I'm truly honored to have crossed paths with. On one of my visits, when I came back, I said, bro, like, you did such a good job. I had a girl call me gorgeous. Like, that doesn't happen. My purpose and my reason for wanting to get this procedure done was because when I looked in the mirror, I didn't like me. I wasn't happy. I did it for me. The compliments are good, but it wasn't what I needed. I needed to feel better about me.
1, 2, 3.
Building a new relationship with an entire clinic that all stepped up to the table to help me achieve one of my dreams. And I'm forever grateful.
So that was pretty cool.
Yeah, I love
Yeah.
his story.
If you guys do have questions, definitely send those in, like Bianca said at the beginning of the presentation. And we'll stop intermittently and answer some of the questions. So, people who have dentures going to implant bridges, which they call them hybrids, but they're really just a big implant bridge. That's a really good treatment for people who have to use a lot of adhesive. Their denture doesn't fit very well. They can't chew or bite into foods the way they would like. This is a really good option. And a lot of the patients that we treat and convert them from a denture to the implant bridge, they actually tell us that, their taste improves. They can feel the temperature of foods because, with the denture, it covers so much of the inside of the mouth. And, the roof of the mouth is completely covered with an upper denture. And it does kind of block a lot of the taste and just
food.
Overall sensation, because you can't really tell, is the food touching the roof of my mouth or is it on the teeth part? So to be able to open that up and expose all that tissue and the skin on the inside of your mouth, that's a big thing for people who are going from a denture to the new teeth now procedure. And just seeing the before and afters. It's really, really cool to see how good the patients not only look from an appearance standpoint, but how good they feel about themselves. And just looking at that before and after, that's just a big change. So zygomatic implants, I do want to spend a couple minutes talking about these because these are one of the utilities that we have here that allow us to treat patients who most other oral surgeons, that they either can't treat the patient or they would need to do extensive bone grafting, and which requires a couple different procedures and a long recovery because you usually have to take bone from somewhere to put where you want it to grow. There's no guarantee that it'll grow. There's no guarantee that it all grows or enough grows for implants. And, for the most part, they heal very well. But the time and the recovery is just a turnoff for a lot of patients.
It adds a lot more time.
Yeah, a lot of time. You're talking you do the bone graft, you wait 9 months to come back and see if you have enough bone for regular implants. With the zygomatic implants, they are the best thing ever for patients who don't have a lot of bone in the upper jaw, because we can totally bypass where you have insufficient bone, anchor them into the zygoma, which is your cheekbone. The recovery is still pretty much the same, but you don't have to go through the grafting, and we're anchoring the implants into the bone that you have grown and developed with, not bone that we're trying to encourage you to grow in a certain spot. So at my hands, I feel like that these zygomatic implants heal better and are stronger at the end of the day than implants into grafted bone. And we've seen a lot of patients, I think the ultimate testimony to that is I've never seen a patient who has a zygomatic implant who we've gone back and bone grafted to put a regular implant in.
Right.
Okay, so think about that for a minute. But we've seen several patients who have started off with bone grafting and now need zygomatic implants. Right. So they're kind of one of the things that, I don't even do bone grafting anymore for the new teeth now procedure. I go straight to the zygomatic implant because they heal so well, and we can do them still in the one day, which is what patients want, what we want. So, with this lady, here's her before and after, and she'd been told by several different dentists that she wasn't a candidate, not even for bone grafting, because she needed, so much. So we did zygomatic implants, and that's her after. She's got
her whole face
a
has changed.
Fixed bridge, right, where she can chew and eat what she wants, and she looks really nice. And with the teeth, I hadn't mentioned this yet, but you get to pick out. My goal is to give you functional teeth that you can chew and eat and be healthy with. But the benefit, just added on, is the cosmetic part. So you get to pick out what you want your teeth to look like. And you play a big role in that. So not only do you get teeth that you can chew and eat and you're healthy with, but you also get a very appealing cosmetic result as well. So another, patient, and, she came down from the northeastern part of the United States, and she needed zygomatic implants. She knew she needed zygomatic implants. She couldn't really find anybody up there to do it. So we had everything kind of coordinated and set up, and she came down, and that, her upper teeth that you're looking at there is one big bridge, and it's completely failing. So we end up taking out that bridge, cleaning out all the infection, putting in zygomatic implants. And this picture is showing, these are the zygomatic implants going into the cheekbone. These are the traditional implants on the top. So you can see she's got 6 total implants, all in a perfect position and good bone. And this is her result. So this lady went from, she couldn't find anybody to do the procedure, and she didn't have enough bone for implants, to that result after. And that, I think, is kind of what we can do consistently to help patients, get fixed teeth in the top.
And we're one of the only places in the world that does it consistently like this.
Yes, and we do more than anyone else by leaps and bounds. Like, it's not even close. Which I don't really understand that, but why there's not a lot of people doing this. But for whatever reason, that's good for us. We have a lot of patients coming in. And it, which also we've got a lot of experience doing it, which I think is very important.
Definitely.
So, with this patient had no bone in the upper jaw, and they needed something called the quad zygomatic implant case. So we did 4 zygomatic implants, and there was a little room to do one traditional implant right there, which, any support that I can give you, I'm going to try to find it and do it. But you're literally taking a patient who has nothing to a fixed bridge that they can now chew and eat whatever they want. So another part of my practice that I'll speak on, just spend a few minutes, not very long, but is the New Teeth Now Total Facial Makeover. So part of my practice is also facial cosmetics, as well as facial trauma. And, when you can add on a couple of different, cosmetic procedures, that can take patients, not only give them new teeth now and a fixed bridge with implants, but also do like a laser resurfacing. So it totally takes their skin back like 10 or 15 years, do a neck lift, do upper eyelid procedure. There's a lot of things that we can tag on. So you can literally go to sleep. I can take out all your bad teeth, get rid of your periodontal disease, put in new implants, give you new teeth, and, take a few years off your face. So that's...
And you're under general anesthesia.
Oh,
so
and you're
why
asleep
not?
for the whole thing. So, it's just something, not everybody wants or needs that. But for those of you that do, it's something that we can do. Mm-hmm. Because when you lose bone from either having no teeth or periodontal disease, when you lose that bone, you lose volume. And when you lose the volume, your face ends up taking the brunt of that. So it shows your lips cave in, your lips roll in, you lose cheekbone support, you lose chin. And those are things that we can pretty quick and easy restore that volume, not with just the teeth, but do a simple chin implant. And I think I've got a picture of a girl coming up that had that. But, there's little things that we can do that can make a big difference on the overall result. So cheek and chin implants, brow lifts, eyelid enhancement, facelift, neck lifts, rhinoplasty, which is nose jobs, lip lift. We did that recently on a patient. Made a huge difference before and after. This lady, she came in, she had no idea that I did facial cosmetics, and she saw a little brochure up front. So she asked me about it when she was here to talk about her teeth. So we ended up taking all of her teeth out in her mouth, all the upper teeth, all the lower teeth, putting in implants, giving her new teeth, and a CO2 laser resurfacing of her face. And that picture is about 6 weeks after, and it looks like the before's younger sister.
Yeah.
Just
She's
a
glowing.
really, really nice result. So another patient, this lady had a facelift, face and neck lift, which if you look at the jawline,
It's much sharper.
yeah, here you can see some sagging skin, some jowls. The neck is a little full. Here, a lot sharper, defined jawline, and the jowling's gone. But she still looks real natural.
Mm-hmm.
Same with this patient. So Shirley had brow lift, face lift, and neck lift with liposuction. But if you look at her, she doesn't look like a plastic surgery patient. She's
she looks
not got
natural.
that wind tunnel. She still looks very natural. But if you look at her, look at that in profile. That's a big, big difference. If you look at her eyes are more opened up. Her jowling here is significantly improved. But this neck, if you look at that after versus that before, there's not a neck here. And here
Right.
she's got that nice jawline
Curve.
there. So here, chin implant. In the before picture, this dimpling, that's where she's straining her mentalis muscle to try to get her lips to close. Here, she doesn't have to do that anymore. Just a huge difference. And that's a 30, 45 minute procedure. So with dental implants, they're never going to need a root canal. They're not going to decay. They're very easy to maintain. And, if you look at just the different, I love him. And I love the before and after and the effect that it had on his life.
It
Because
changed his whole life.
oh, huge. And, that's why we do it, And so the easy to maintain, what I tell you is you treat them like your natural teeth. You brush them. You got to brush them and take care of them. You can't get these in. It's not like some magical procedure where you don't have to brush your teeth anymore. Take care of them. You got to brush them, morning and night. You can't floss them. So a lot of people like to use a water pick,
Right.
which really does a nice job at helping you keep them clean and keeping the gums healthy. And then every 6 months, just like I do, just like you do with your natural teeth,
Yep.
you go to your general dentist and you have your teeth professionally cleaned. Anything that you can't take out of your mouth and wash, under a sink with soap and water, you have to get professionally cleaned. Because what happens, the way your spit glands are designed, where they empty in your mouth, you will collect plaque and calculus. And that's something that you just can't brush off. So you have to go get that professionally cleaned off. But it can't get any easier than what it is with these teeth. Because what they do, your dental dentist will unscrew them, take them out, take them in the back in the lab, clean the plaque and calculus off, steam clean them. So any little stains from, those of you that smoke or red wine or coffee drinkers, steam cleans it, gets any stains off. And the stains are pretty much the same as it would be for like me with my natural teeth. So I drink coffee every day. So when I go in to get them clean and they polish them, there's a difference, when I leave. The same thing with these. So we can steam clean them, get all the stains off, put them back in, and it's like, taking your car to get it detailed. They're pretty much taken back to their brand new state, put them back in your mouth, and you leave.
Easy.
Super easy. So here, here's Terry back with us, and we're going to show you his second video to where, it gives his reveal.
Yep. How he's doing now.
And I've had women say on dates like, what happened to your teeth? Or, so you're gonna get your teeth fixed soon? Wow.
Hey.
Oh my God. Wow, I love it. It's been 2 months since my procedure. I feel great. I feel wonderful. I love my smile. This was the best thing that happened to me in a very long time. I can't say enough good things about Dr. Kirkpatrick. He's not Dr. Kirkpatrick the surgeon to me. He's Dr. Kirkpatrick. He's You know, I could talk to him like I'm talking to you. I don't think anyone in the world could treat me as well as he treated me. You know, because I'm very happy. I've been telling you this the whole time. I am so happy with my implants. I look at before and after pictures and I'm like, I changed so much just with this procedure. I have more confidence. I would never be so outgoing the way my teeth were. And now I talk to everyone. Right now, summertime, I'm still a big paddleboarder. Hey, Christy, you ready to go out?
I'm so ready.
Awesome. Kayaking, paddleboarding, mostly paddleboarding now. It's my new sport. I paddle with 2 young women, very nice smiles. I've had a lady on the river saying, you guys, all 3 have the greatest smiles. And I'm telling you, I got so many people. I'm a paddleboarder. I'm always on internet sites that, you know, Facebook sites and Instagram and a lot of Facebook groups. And I get a lot of compliments on, oh, you got a great smile, you know. Oh, I love seeing people smiling when they're paddling. And I smile all the time. I get more compliments on dating sites because of my smile. And all of a sudden, everything has changed. It was like hit after hit saying, oh, you got a great smile. You know, your smile makes you look quite young. And they think I'm 35, not 55. I eat that stuff up, you know. Yeah. As gorgeous as I thought I was, I'm twice as gorgeous now.
He is just so much happier and more confident and 2 times as gorgeous as he said. So it's really great to see the difference.
Yes, it
That's
is.
great.
And, you know, the really cool thing with Terry is he gets to play around with his teeth. Like he's making, you know,
Yeah, he gets to make his own
he's
teeth.
making his own teeth, which is, I just think that's pretty cool. So, one important thing that you guys need to get out of this presentation, and I feel like sometimes I don't stress this enough when I'm talking to patients, but the everything under one roof is, I can't express how important that is and what a huge advantage it is for our patients, because to have everything done here, from, you know, you come here for the consult, you come here for the impressions, your teeth are made here, the surgery's done here. I mean, the lab and Terry, they're here
Yep.
in this office. So for them to be able to come out and talk to you and look at you and look at your facial skin, look at the way your mouth moves, you know, that's a big advantage for the lab technician, which turns into a huge benefit to the patient because they can see your skin tone. They know what shade of tooth would look good.
And a lot of offices don't have that.
No,
Yeah.
and even the final teeth is milled here, so everything is done here. We don't outsource anything, so we don't take impressions and send them to a lab in China to have them make your teeth, or a lab in California. It's here. We're not relying on, you know, another state, a lab in another state to do everything that we want and then send it back here and we open it up out of a box and expect it to be perfect. We see it before it even comes out of the lab. So the quality control is a big advantage. And, you know, if it's not right, we don't have to send it back and then wait another 2 weeks to get it back. We take it back into the lab and they fix it. You know, so it's that's a huge advantage. And then you're not bouncing around having your surgery here and going to a general dentist office or restorative dentist office somewhere down the street or another town to have, you know, them make and put your teeth in. It's all done here. The procedure is done in just 1 day, and you do get 2 sets of teeth. Your temporary teeth that we put in the same day, they're made out of acrylic, and there's some really good reasons that we do that. Is they're very easy to adjust. So you're constantly telling us and telling me where you're happy at. And what I mean by that is when I'm doing the procedure and I put the teeth in that day, I'm doing it with you totally asleep. So your muscles are totally relaxed, and that may not be where you're happy at. So when you wake up and your muscles start functioning again and your jaws are opening and closing, where I put you when you're totally relaxed may not be where you may have your right side of your jaw contracts just a little harder than your left. So you may be hitting harder on that right side. So with your temporary teeth being an acrylic, then I've got the ability to just quickly and easily adjust it. And we do that throughout the whole 6 months, because it takes 6 months for your bone to fuse with the implant. You still have a bridge, you still have it attached to your implants. It's not removable, and it's as we want to make them just like what you'd want your finals. So we call them temporary teeth, but I think the more appropriate way to describe them, one of our implant coordinators, I heard her tell a patient, they're not really temporary, because temporary is not she didn't like that word. She said, think about them as your test drive set. It's like you just came in and got them, and we put them in, and you get to test them. So if there's things you don't like about them, they can be changed on the finals. If there's, you were scared to go to a really white color of teeth, then you can change it and go whiter on the finals. So that to me is another big advantage of doing it here and having the two sets of teeth. Your final teeth are made out of zirconia, which is the most cosmetic and strongest material around. We have a lot of people coming in that, they've been other places, and they were telling them that they put on the final teeth the same day or the final teeth the next day. And that to me is, when you really sit down and look at what you're getting, it's insane, because you cannot predict how patients are going to heal after this procedure. We know your gums are going to shrink, and we talk about that in detail when you come in for your consult. Well, one of the things that when your gum shrinks, now you've got a little gap between your bridge and your gums. And you're going to hate that as a patient.
And you would have that forever if you had your
you'd
final
have it
teeth.
forever. Or what they do that we've learned is, they just patch it with a little acrylic, which is what we use for your temporary teeth, on top of that, or composite to fill it in. And it's not the more permanent material. But if you just wait until the implants have healed and your gums have stabilized, and then take new impressions, which recaptures the new gum level, and make zirconia teeth to butt up and touch and close that space.
You're much happier.
You're so much happier, and you've got a product that's one piece with not kind of added layers on top that can chip and break off. Mm-hmm. So what others kind of tell patients and market as, you don't want to go somewhere where they don't even give you your final teeth for 6 months. Like, that to me is the big advantage of why you need to come here.
Yes, done the right way.
You really need to consider that. The consult, your first appointment, is about an hour long, and you come in, you'll talk to me and one of my implant coordinators. We do a CAT scan. We look at it together, and by the time you leave here, you're pretty much radiology certified to read a face CT scan, and because you've watched me go through it, and I show you exactly where I'm putting your implants, how I'm going to do it, and pretty much what size implants. So we get a lot of detail out of that. These are our two implant coordinators, both Shauna in the blue shirt and Debbie in the black blazer. They've been with us forever, it seems like, and they're both really, really knowledgeable and just excellent with patients.
Yes,
you get to know them personally, and they really help guide you through the process. Here are our restorative team, and Dr. Nafala and Dr. Dibbs. They've both been doing this for a really long time with us, and it just seems like that. When you look at how many cases these two have done, it's insane, because most people haven't done a 10th. Right. Even people who do this, every day, still haven't done a 10th of what these two have done.
Right.
And it's just because that's what we do.
And we're going to hear a little bit about Dr. Dibbs and the dental lab. He'll explain a little bit about the dental lab to us.
Yeah, so we'll go to the video now.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. And we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Even like what Dr. Kirkpatrick was saying earlier, it's amazing that our restorative doctors can walk across the hall and work with the lab, and the lab can work with patients.
Yes. And I like that video because it does show how a little bit of how they work in the lab. And, it's a little tiny, I've never really paid attention to that watching this, but that little tiny paintbrush, and it's,
they're like artists in there.
Yes, they're certified dental lab technicians, but they are really what they do is art, because they're creating
individual
the appearance
teeth
that you want,
Yeah.
and they're all different.
Yes.
Everybody, not everybody chooses the same appearance of their teeth. I've had a patient that, he's actually the oldest patient I've ever done with this procedure, and believe it or not, he was 91 years old. Came in and it took all of his teeth out, implants in, and he's had them in now for he's almost 5 years out. Still going strong.
Wow.
Healthy. You see him, he does not look his age. But the reason I brought him up is he told me that ever since he had his adult teeth, so for, 91, so he probably got him so for almost 75, 80 years, he had same teeth with the same appearance, and he had a gap between his two front teeth. And one of his stipulations, he wanted this procedure more than anything, because he said no matter how long he had left to live, he wanted to be able to eat what he wanted to eat without pain, and his teeth were breaking down. But he was not going to do it if I couldn't give him his gap between his two front teeth. So we did. So we made him, it was like, are you sure? Like, dude, I can do instant braces on you. It's like you went through and had orthodontics and we straightened everything. He's like, no, I want my gap. So we made him with a gap. So here is, obviously me and my surgical team. They've all been with me for years, and they're very good at, helping me help the patients. And it's just a huge team event, and takes a huge effort on everybody's part to do this and get our patients, treated in an effective manner, in a safe manner, and at the end of the day, get you the results you want. And so you'll get to know, if you come here for me to treat you, that you'll get to know all of them, and you'll see them. That's another thing about this office, where you're not going to come here and see me for a consult, another surgeon for the procedure, and then someone else for your follow-ups, and like 50 different assistants running around. It's you
get to know your team.
Yes, you get to know me, and you'll know Sherry, Corey, Amanda, and Alyssa, because they're going to be very much involved in helping me with you. Here's our anesthesia team, and they've both been with us for years and years. They're very experienced, very good at what they do, and I feel so strong about that Kim actually put one of my kids to sleep. And trust me, I love my kids. If I didn't really like them, maybe it'd be a little different story about how I'd feel about Kim putting them to sleep. But I really love my kids, and I trust both Kim and Jack to put them to sleep. So definitely, I feel comfortable with them putting my patients to sleep. So here is the front of our office. It is a big building because we have everything here, and we've got a big team. But like I said earlier, it takes the whole team effort to get this done and make it happen and keep our patients happy. So Bianca, I think you'll go over some more details, but definitely submit questions. We can still be on here for a little bit answering questions. Call that 1-800 number. We'd love to see you for consult or answer any questions we could over the phone. Let us know if we can do anything.
And if you have been with us for the last hour, you've definitely been listening for a reason, and this procedure is probably something that you need. But you are in great hands with Dr. Kirkpatrick. As you can see, all the amazing transformations that have taken in the lives of our patients. And we just want you to let us know how we can help you. We want to answer your questions. Come in for a consultation. So you can give us a call. Our number is 1-800-615-5838. You can talk to me, Nicole, anyone that answers the phone. We'll answer all your questions and hopefully get you scheduled for a consultation. But we thank you for tuning in to the webinar tonight. Thanks, Dr. Kirkpatrick, for being here.
Yeah, thank you, Bianca.
And we hope everyone has a wonderful holiday season coming up.
Absolutely. Thank you guys for being on here.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.